So you might be new to PANS or PANDAS and wanting to know what that actually means. PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infection. These are actually kind of the same thing. So PANS is the bigger umbrella for conditions. PANDAS is a specific subset of PANS. So PANDAS is specifically associated when the symptom triggered by strep infection, whereas PANS can be triggered by lots of different things, anything that can trigger an immune response. Essentially what's happening in PANS and PANDAS is that we have a misdirected immune response. So the body gets exposed to an infection or an environmental trigger. Could be mold, it could be environmental chemicals, it could be allergens that are just really strong, something that will trigger an immune response. But the body ends up attacking the nervous system as it's trying to fight off this other thing that it sees as an invader to the body. And that's where we end up getting all of the neuropsychiatric symptoms. So Jody is going to tell you a little bit about what her experience with her daughter was like. And then I'll jump in and fill in any gaps because this is obviously just one kiddo's experience with PANDAS.
So what this looked like in my home was happy, healthy little girl, and started to slowly see little things like her having issues at school, her having meltdowns on the way home, her just having little episodes, not really wanting to be away from me. And as time went on, there was kind of a cascade of symptoms that just came on. She suddenly had extreme separation anxiety where I couldn't leave the house. She had sleep issues. She had food refusal where she wasn't eating, sometimes called ARFID and some PANS and PANDAS kiddos. She had
ARFID stands for Avoidant Restrictive Food Intake Disorder, just so you know. Go ahead.
Yeah, and she had multiple tics, all kinds of strange body movements going on. She had extreme mood dysregulation. She was having rages. She was having just profound sadness. She was having stomach aches and headaches and nosebleeds, all kinds of, GI in nature issues. Gosh, there was so many, I don't even remember.
Tics, you didn't even touch on the tics yet.
Tics, no, I did. I said tics. Like her body was moving like crazy.
Oh, the cough tick. I think that's the cough tick.
Oh,
was thinking
yeah.
Of.
And that's it. She had so many different tics that it was just complete craziness. She had I can't even remember any more of them. There were so many whenever we first started. She had almost every single symptom except for urinary infrequency, which is one for these kiddos. She went from a normal, healthy girl to, I didn't even recognize her. She was going into spells.
It was pretty quick.
It was fairly quick. She was going into spells where she almost looked like she was possessed. She was just completely out of it. She didn't remember when things would happen. She would sometimes feel remorseful about the things that she was doing. She kept communicating to me that she felt like something was in control of her body and she was trying really hard to stop doing what she was doing, but she couldn't. At the same time, she was able to a small extent be able to control it around other people. So in the beginning, just myself was seeing all of it, and then eventually my husband, but outside of the home, she didn't necessarily show all of these symptoms in front of teachers and medical providers and all of that thing, which made it exponentially more difficult.
So the typical symptoms that you're going to see in PANS are really similar to what Jody just expressed. So what's the most common is to see sudden onset of OCD, food restriction, and tics. And so that could be vocal and motor tics. The tics are going to tend to be more complex tics from the start, whereas in Tourette's, they tend to start with simple tics where you might not even notice it. They take like a millisecond to complete, whereas the tics that onset in PANS or PANDAS tend to be complex from the start, which means that they can take seconds to do, but they involve multiple parts of the body or multiple movements. We'll see a lot of facial tics occur. And again, like I said, also vocal tics can occur as well. The avoidant restrictive food intake disorder, as Jody mentioned, is oftentimes associated more with an OCD rather than like an eating disorder type of presentation. And so there's a lot of fears associated with it. Jody's daughter in particular had some fear related to whether foods were going to hurt her. And so she was restricting foods because she was afraid that they were going to hurt her. You can also see sudden changes in mood and behavior, more often rage, but you can sometimes see sadness and depression as part of that too. Separation anxiety is really common in these kiddos, that were perfectly fine going off to mommy and me, or Mother's Day out type of play groups or school. Some can't go to school, having school refusal. Cognitive regression comes frequently, specifically in reading comprehension and math. Changes in handwriting are frequent as well because of the impacts of the inflammation on the brain that changes the way that the body can actually do fine motor skills. As Jody mentioned, there's also urinary frequency or sometimes incontinence. You can see kids who are fully potty trained having bedwetting. And then just age regression can come on as well. So a 10-year-old can start acting like a 5-year-old. Jody had some experiences where her daughter really wanted to be called a baby or treated like a baby. It was really confusing too. These tend to come on in the literature. They might say that they come on really suddenly over a very short period of time, usually following an infection. It may or may not be known though. Some kids don't have any signs that they were sick. The first sign that they have is that they have these neuropsychiatric symptoms. Some kids, it's not actually sudden though. A majority, not actually sudden. It can be a progression because PANS tends to go in waves. So there's an exposure to something that triggers an immune response that causes an uptick of symptoms, and then the immune system dies down because the body has actually managed to fight it off while it's also fighting itself. Or they're no longer having exposure to the thing that was the trigger. And so things go back down to baseline. And then they have another exposure to something and another tick up. And so it looks kind of like an inclined sawtooth where there's ups and downs, ups and downs, ups and downs. And there's things that we can sometimes dismiss in and the time as something that's just an episode and like this, they're just growing through it. Who knows what this is? It will pass. But then once we finally see that they're at that place where they're not really getting out of a flare, we can look back and recognize, oh, those were all times that there were flares. And so for a lot of people, it doesn't actually happen overnight. It can be more of okay, it's building over time. And the proposed mechanism of action is through a system called molecular mimicry. I'm going to dive into that for just a second because I'm sure that there's curious minds. So basically, the most studies that we've seen have been in strep, and so that's where most of our conversation about this will come from. But there's likely some things happening in other causative agents as well. So whether it's Mycoplasma, Lyme, or co-infections, anything that can trigger an immune response. So basically, the strep comes into the body and it tries to evade the immune system by putting some proteins on its surface that look similar to our cells. This is where what's called molecular mimicry. It's almost like, a lot of people know about the butterflies, that there's the monarch and the viceroys. The viceroys try to look like the monarchs to give them some protection. It's basically like the strep cells are putting on a mask. So they're like putting on a Dr. Bahr mask. And so it's trying to hide from my immune system, saying, no, I'm Dr. Bahr, you don't want to get me. My immune system, though, is really smart and really able to adapt and recognize, oh, that's not quite right. That looks like something with a Dr. Bahr mask on. And so it tries to correct itself and it broadens its attack, which means that it then starts attacking my own cells too. And so when it does that, it causes some inflammation in the body. It causes an attack on the nervous system, which then leads to all of these symptoms because we're having a too broad attack on anything coming into the body. So that's the proposed mechanism of action for what's happening. The symptoms that we see are a result of inflammation, particularly the basal ganglia seems to be the most susceptible in PANS and PANDAS. That's creating a lot of these specific symptoms and the movement disorders that we're seeing associated with it. I want to touch briefly on the fact that there is some overlap with autism and symptoms related to autism. There can be kiddos who have both autism spectrum disorder and PANS, but there are also some kids who get misdiagnosed. They are told that they are a mild case of autism when the reality is that they could actually have PANS. So that we do see that. And Jody, I'm going to let you talk about that a little bit because I know that was suggested to you before you found somebody who understood PANS well.
Yeah, in the beginning, whenever I was going to different specialists, trying to figure out what was going on, I had a specialists tell me that after multiple visits, kind of at the end, just tell me, hey, you need to settle for an autism diagnosis and medicate your daughter for the psychiatric symptoms that she's having. And so I very well could have settled for that. And I foresee that Avery could have been in that boat because she did. There was things that really looked like autism that was going on with her. But I wasn't willing to settle for that because it wasn't my child 4 months before. And so I continue to seek other diagnosis, other treatments, all of that type of stuff. So I definitely see where it wouldn't be too difficult to end up with a misdiagnosis with a PANS and PANDAS kiddo.
Yeah. And the reality is there can be people who are on the older side that may have been given a mental health diagnosis that can also be inaccurate. As I shared briefly in our introduction video, I ended up with mental health diagnoses, a couple of different ones that in retrospect, knowing what I know now about PANS and looking at my history, was actually likely PANS as a child that developed and progressed into something that got labeled as a mental health diagnosis. Same thing for my brother. And so the challenge that we're really struggling with here when we deal with PANS and PANDAS is it is a clinical diagnosis, which means that there is not a definitive test. There's not a marker that says this is definitely PANS or this is definitely PANDAS. There are some tests that can be suggestive, but nothing is definitive. And there's so many things that can contribute to it. And so we can really get stuck in like this idea of a diagnosis being the most important thing. And it's useful because we need to know what it is that we're working with. And we'll talk about that a little bit more as we move on to talking about homeopathy in particular, because diagnosis is not crucial for homeopathy, and it's not going to specifically dictate what somebody is given to help them actually heal. However, it can help us understand how to manage the condition and what to expect with it. That being said, we use a clinical diagnosis for this. We understand it by knowing what the presentation looks like, getting data around what the patterns are, and if there was any exposures to something that could have been an immune trigger. So whether we're going to label it as PANS or ASD or bipolar disorder or OCD or oppositional defiant disorder, or Lyme or mycoplasma or strep, like those are not really central to what our ultimate goal is, which is getting these kiddos better and getting your kids back, getting your family back, getting your lives back. So the diagnosis does matter to an extent, and it's not the be all end all. The diagnosis, I mean, Jody, I want to actually let you wrap up here on this part because I know that you are one of those moms who felt that if you just got the diagnosis, that was going to be the answer, and that was going to be the solution. As soon as you got the diagnosis, you were going to know exactly what to do. And I know that really wasn't how it turned out for you.
Yeah, it's tough looking back on it because I fought so hard for a diagnosis because I thought, number one, I just needed to be validated. At the time, I felt like I needed a medical professional to tell me, yes, this is what it is. We spent a lot of money doing tests, doing all the specialists, everything to seek diagnosis. And in the long run, those things were not what got my daughter to recover. I know we'll go into that deeper in later videos. But yeah, I think when we first get started, we are so driven to get a diagnosis. It's super, super important. But like I said, for us, it didn't change anything getting that diagnosis. I just made myself crazy.
I'm not trying to discourage you.
Yeah.
Right. I'm not trying to discourage anybody from getting a diagnosis because a diagnosis can be useful. I am just trying to help you to understand that a diagnosis is not likely to be the answer. And once we get a diagnosis or we understand, okay, like I have these symptoms, I have PANS and it's caused by Lyme. Again, that is not necessarily the answer to getting you out of this as your merry-go-round. And the reason for that is when we get the diagnosis, we're going to, and if we're not using homeopathy, if we're using conventional, functional, other natural therapies, integrative medicine, we're going to have more specific approaches with having a specific diagnosis or an identified pathogen that is causing it. However, it's not getting an actual root cause of what is leading to this. And that's what we're going to talk about in our next video. So I hope you'll catch us there.